What young people are asking for is a very broad question, but I think one of the most important and first priorities is that they would be recognized as a very specific and distinct population. Because a lot of cancer plans either focus on childhood cancer or adult cancers and different tumor types, but adolescents and young adults who we now know have very distinct and specific and different needs than children or older adults are not always recognized as a specific population, and therefore there are no specific strategies for meeting their needs. But one of the very important things that we found when we have done a 2.5-year very, very large study across Europe is that to meet adolescents and young adults' needs in the clinical setting, you don't necessarily have to have dedicated AIA clinics or dedicated AIA sections of the hospital or wings, which sometimes can be very, very costly to build and to maintain. But what is most important for them is that they are treated holistically and that there are a variety of services available for them and that there are specific and designated coordinators for their care. So they don't get lost in the sea of so many older patients, but that there would be dedicated and trained personnel who understand their needs and services that might not be so relevant for older cancer patients, such as fertility preservation, mental health support, family support, maybe childcare support, transport support, or even caring for those with anxiety or neurodivergent patients, are going to find those quiet spots. They will find information in their own language, age-appropriate language, clear information, clear signposting, and that there would be liaisons very specific for AYAs in hospitals, whether they are treated in pediatric or in adult wards. I think it's very important to collaborate with lots of patient organizations where you want to change legislation or where maybe even, as we have understood, the legal framework has already been changed. For example, with the right to be forgotten, there is now legal protection for cancer survivors in Italy. However, if there's not enough awareness about this, it's really important that it's cross-cutting collaboration between different sectors, between different stakeholders, and across patient organizations. There are some patient organizations that are very noisy and very powerful and work well with media, social media or mainstream media outlets, and they can be very useful in bringing more awareness. But then maybe also finding which government departments could act as watchdogs and hold offenders responsible and accountable. It's very important to specify, and it's very important to find out and to collaborate with them, because just because something is law, it doesn't mean that everyone will be abiding by it and that every sector will be abiding by it. But if you find who are those organs that are holding them accountable, then you can work with them. And obviously this will take time, and sometimes will take several years, but change is going to happen if you come at it from many different angles. Awareness around patients, connection with media, working together across many different organizations, highlighting best use case scenarios and good examples, highlighting bad examples, pointing them out, and working with those enforcement agencies who actually monitor that these laws are being implemented.